This is the second lecture series on research lectures, and the main reason we're doing this is to help you all do your theses and things like that. So we've got a good lineup of lecturers today. I think Prof. Gauri, Dr. Jasmine, Dr. Tanya, and there are quite a number of people who are here with a lot of experience who are going to share with you how to start on your research project. Very briefly, I'm not going to give you any PowerPoints and all, because I think Gauri is going to cover a lot of this. But you must remember there are many reasons to do research, but one of the most important for all of y'all is it is a precondition to sit for the final exams. Without a proper presented research which is accepted in your thesis defense, you will not be able to sit for the final exam. So remember, you must have a good thesis which is accepted by the defense panel, and that's why you need to pay attention to all these lectures and do your thesis as well as possible. Gauri asked me to talk a little bit about selecting the correct research topic. I think a lot of that is going to depend on your interest, your own personal experience, your various journals you read, conferences. It can even be part of a larger research project. But those are the kind of things you have to discuss in depth with the supervisor you are allocated, and come to a consensus. Because if it's something you're not interested in, it's going to be very difficult for you to push the project through. Of course, you have to remember that a good research question begins in the mind of the supervisor or trainee, the person who's doing the research, and so that the good research question is essential. Okay. I think Gauri will go through a number of the criteria on how to develop a good research question, which is the primary thing you need to, when you're starting a research. The most important thing you need is a research question. And to define a research question, we have got criteria like, for example, the FINET criteria, which I think Gauri will go through in detail, including the feasibility, whether the topic is interesting, how novel it is, whether it follows all ethical rules, and is it relevant. These are the kind of things you can use to choose your research topic. And again, I think I won't go through the examples because Gauri is going to go through all of them. The final criteria, which she will show later, it's probably one of the most important things you can do to establish whether your research question is valid. Subsequently, you will also look at to develop the research question, you can use other criteria like the PICOT criteria, which talks to you about the patient, intervention, comparison, outcome, and things like that. You must remember, a good research question will allow the target population to be clearly identified. It must guide your choice of study subjects. It must identify the outcome variables clearly, and it must determine what type of study is needed and the best way to collect the data needed. And finally, it will the research question is able to influence the number of study participants. That's why, like I said, the first step, which is the most essential, is develop a good research question once you have discussed with your supervisors, right? What about your supervisors? You will be allocated appropriate supervisors for your research. Nowadays, I think we even allocate 2 people, a junior and a senior person. You must you must meet your supervisor. When you meet your supervisor, you must have an appropriate list of research topics you're interested in. I mean, most of the time, the supervisors are going to give you the topics, but it'll be good practice for you to go to them with a list of interesting research topics you have. You must always be wary of your timeline. Remember, most of y'all will be starting your research at the end of your first year or the beginning of your second year. That gives you roughly about 2 years to complete your research. You must vet the proposal adequately, especially the final criteria and the research question, which are probably the most important parts of your research itself. You must try to meet your supervisor regularly, preferably every 3 months, and you must document the meetings and the outcomes. You must keep track of the presentations and deadlines, and you must take into account when you present every 6 monthly in your thesis review, you must take into account the reviewer panel's comments and try to address them as well as possible. starting your research as soon as possible is the best thing for you to do, because it will take you about 2 years to collect the data, to analyze, to write it up. So don't wait too long. By the time you're in second year or mid second year, it's a bit late for you. Okay, there is a lot of things that can go wrong. There may be inadequate progress. You may be unable to complete your task in time. You may have difficulty with writing in English. These are things you may run into, and these are the kind of things you have to discuss with your supervisors, preferably early. You also have got a support system within the department in terms of the research unit, which comprises of all your clinicians, as well as research lecturers like Prof. Gauri, Dr. Jasmine, Dr. Tanya, who are all available to assist you in trying to get this done as soon as possible, right? So I think that is my short introduction for today, because I think Gauri will cover most of this research proposal later. Is there anything else I missed, Gauri?
Yes, no, you didn't miss anything, but you did mention that they're supposed to meet preferably 3 months once. They're supposed, they mean that it's face-to-face physical meetings, right? But they
Yes.
should update the supervisors a bit more frequent than that.
Oh, so you're saying, oh, yes. 3 months is the physical meetings. But of course, if you can meet your supervisors even more frequently, that's even better, and keep them updated in any problems and any progress and problems as well. It's always good practice to keep them updated. A lot of the times we hear from supervisors that you guys only meet them 1 week prior to the review. And that is not good. I mean, you can't expect your supervisors to do anything if you're just going to meet them 1 week prior to your review. So please do meet them regularly, update them of problems, and talk to them. If you're having problems with your supervisors, then you have to move one step up. And one step up usually means your program coordinator. In the case of general surgery, that would be Prof. Kun Leong. In the case of neurosurgery will be myself. In case of pediatric surgery will be Prof. Shireen. And if the problem is either myself, Shireen, or Kun Leong, then you go one step higher than that. You meet the head of department. It has happened before. We've had students with problems with supervisors. So that's their pathway. So you meet your program coordinator, and if the problem is your program coordinator, you meet the head of department. And try to sort out the problem as early as possible. The longer you keep it, the more the problem builds up, right? Anything else, Gauri? Anything else you want me to cover?
No, I think that's basically what they needed to hear for the opening of this proposal defense talk series. Thank you so much.
All right, thank you.
Yeah.
I'll let you all continue then.
So the next will be actually my talk, which I've actually pre-recorded. So Leslie is going to help me share the video, which will be covering the aspects, as Prof. Arvind was already introducing my talk on behalf. It will be covering a bit more on what he's been saying. Good afternoon. My name is Ratna Gauri, and today I will be talking to you about writing a good research proposal and its aspects. So what is research? So basically, research is a process of searching an information, or searching in general for information, or a repeat to answer the unknown aspects of what is already known. So actually, if you use Word document and PowerPoint and ask them, show me how to do research, it actually comes up with this for you. So this is just an automated example, which is given by PowerPoint, which is, it tells you research. For a researcher, you need to start gathering your information into your Word document. You do it by knowing what your research topic is and gather information in that area. You then select texts and areas which are relevant to what you want, and you cite it while you write. And by doing that, you will have the reference tab, and you select how you want the reference style to be. And once you get all of this, you will try and collect information from various sources, from books and articles and so forth. You then evaluate, compare, contrast that sources and information which you're looking at for that specific topic, so that you can decipher whether it's relevant information or not and trustworthy information or not. And you start to narrow down the topic and put it into sections. So you can put into sections of these kind of information, paragraphs and references go under epidemiology, this goes under prevention, this goes under pathophysiology and so forth. So you organize, basically what I'm saying is you organize your references, and not really your references, your information, you put it into a structure. And then you will present it. You present everything, as we said, present only the key points. And so now I want all of you to think about this question. Have you all done research before? Well, I guess some of you all are probably in your second, third year, so most of you will say yes. But do you think you have done research even before you started this program? Have a think about it, because if it was a bit more interactive, I probably would have asked you to answer that question to me. But anyway, think about it, because why am I showing you this clinical setting? Clinical setting, what happens in your clinical setting? Well, this is what I believe happens. Correct me if I'm wrong. Is that you are a problem, a patient will come to you with a problem, they're presenting you with a problem, clinic or at emergency department, and then of which, looking at the signs and symptoms or the presenting symptoms, you'll start to think of the possible diagnosis. So they come and say, my arm is hurting. And when they say that, you could think, is it hurting because the bone is broken, or is it just something superficial and so forth? So you'll come up with possible things, and then you will start to do history taking, and you also decide on your inquiry plan, where you think about maybe to do an x-ray or and so forth. Okay, and history is important because you want to know how they got that injury. And once you come up with your inquiry plan, you will then run the examination, you will do the physical examination, you will send requests for the whatever you plan to inquire. So if you're looking for x-rays and so forth, you will get that ordered in. Maybe even worse, you might want, probably not for arm, but say if it's a head injury, you probably will ask for scans. Yeah. And then you'll think about immediate treatment plan and long-term management plan for that presenting problem. And you will then eventually follow up as well. Okay, so this is why am I talking about this? Okay, talking about this because technically this happens when you are running a research. You will have to come up with a problem statement, the rationale of why you want to conduct the study, because without a problem, there is no question. So what actual problem are you facing? With that, you will then come up with your research questions and possible answers, possible outcomes. So your differentiational diagnosis per se to the question which you want to ask. Oh, did they injure their arm? Is the bone broken? So the answers to that is yes, no, maybe. I will need to investigate more before I can answer this. I don't know. There is more than just yes, no, right? There is that maybe as well as a possible reason. Or did they break the arm because of an accident? How did it happen? So those are questions which you'll be asking yourself, right? And then you will go off to do literature research to answer that question. And in this case, basically you go back to history. Okay, so to be able to answer a research question, you need to see what has already been done. And so you will go back to history. So you have to do a literature search, okay, which I believe that was covered by Jasmine, right? And then you will come up with your primary objective, your secondary objective, and the protocol on how you want to run this study. Then you'll run the study by collecting information and data, and then you will use that to discuss and come up with a clearer conclusion and direction. And later in the future, you will then be able to say what went well, which is the strength, what were the limitations when you were trying to answer the research question, and what should be done next now that you found this finding, what is next, and suggest improvements in making these kind of studies better. So, as I said, if you think about it, you are already kind of practicing it in your practice, but in a clinical setting. Because your follow-up, basically you follow up, you will be looking at improving your practice, right? Improving taking care of your patients. So in terms of treatment plan and management, you'll have your discussions and your MDTs and so forth to come up with the best management plan for your patient. And in terms of data collection analysis, to run your examination and investigations, you are collecting data. In terms of coming up with how you want to go about collecting this data, that's your inquiry plan. And so your execution and so forth, okay? As I said already, so this one I covered. I told you that literature review is basically going back and knowing what's already in the archives, which is history. So why are they making you do research? Well, they're making you do research. By the way, I would like to thank Prof. Byron. There are some of these content which I was able to get from him. So I'd like to thank him before I forget. So, and some of these slides which are upcoming, some of it are originally from him. Okay. So why are you all doing medical research? Like, really, do you need this additional burden of doing research? Well, one, the scientific interest. I don't think you're bothered about the scientific interest, but it actually teaches you how to deal with information, which there's nowadays a lot of information overload. So by having some basic research skills, you will know how to decipher what is relevant information and what is not relevant information. And that is taught by you doing a project of your own. Okay, eventually what you do can contribute towards your project, might contribute towards medical knowledge. It will teach you some IT skills. Okay, it will also a good way for you to progress in your careers. It is, as I said, it teaches you to evaluate and apply evidence-based medicine and practices. It's also good if you are looking into a way of consulting, if you are thinking more of an academic career. But having said that, I believe everywhere everyone is a mentor and a teacher, whether you are in an academic setting or not. So research is a way of doing things in a more structured format. So it teaches you to do it in a more structured format and educate people who are training under you in a structured format. Hence, it builds and cultivates team building and ability to network with people in your field. And it teaches you how to be disciplined, because you're only given probably maximum 3 years to actually do the actual project, probably a year and a half to collect data. So it teaches you how to manage time. Okay, and it also, in terms of towards the end, during your Viva session, besides the booth, which is to praise research papers, learning how to debate is a skill. So learning how to defend your theses ends up helping you in a structured format. It will end up helping you in your Vivas, actually, because in your Vivas, it's basically you're given about similar time to present, 7 to 10 minutes, yes, and you are supposed to defend why your idea is viable, what you're saying is correct, and so forth. So it's a short time, and you need to be clear, to the point, and not talk gibberish, and making sure that you get as all the marks as possible, right? So it's actually not just for you to appraise papers. Yes, it's important, because you don't want to follow a paper blindly or a guideline blindly. You want to make sure the guidelines you're using is appropriate for your practice, but it also can help you with your exams, and not just one exams, all your exams. Okay, that's why it's in your program. Next, what are the elements? I will expand on these things as we go along. What are the elements? Okay, so the background. So why is your study important? So why you need to do this? What is the gaps in knowledge? By doing this, what you are hoping to improve. Then next is then you come up with the question. So knowing what's done and not done, you'll be able to narrow it down to what is really needs to be answered, what is still unclear. You will set your question, your aim, the whole purpose of doing a study. There must be a purpose. It cannot be that it's not been done in our country unless there is some relevance to it. If not, don't use that as an excuse, please. Be something which is going to help a patient wholesomely, or a very specific, yes, it can be specific group, but why you want to help that specific group? Are they having this burden the most? Okay, so it's something like that. So the relevance needs to be there. I'm going to get to the final criteria, so I'm not going to jump onto the next slide. Then your methods, you decide how you want to study this. There's many ways of studying it. You can even use audit as a method, retrospective study as a method, but you have to justify why a retrospective study is the best way to answer this question. Why is audit method the best way to answer this question? Okay, and then you decide your population and sample size, and you have to get your ethics, and you need to be very clear with your timelines and be complete on time. How do you then go about that? So you need to identify the problem. So what's the broad topic? Global warming, colorectal cancer. Then you frame the questions. So these questions, in fact, which I've put here, which was framed initially and I've modified a little bit from Prof. Byron, is that does cow dung contribute to global warming? Okay, is this even relevant? Is this even important? What is this? Really? Is this is the question correct? Then maybe this question is a bit better. Does regularly screening reduces colorectal cancer rates? Yeah, that is something which will be interesting, but isn't it a little bit broad? So you probably want to be more specific rather than a broad question, because a broad question like this has probably been answered before, especially with current times where people do large nationwide database studies. Okay, so then you'll search literature, refine this question more because it's obviously broad, state your objectives, and as I said, you start to implement how you're going to implement it, and you present all of this to us at PD, and you will present it progressively until you have to defend your findings and so forth. Okay, so then you have to have that's why you need to have a specific question, not too broad. It must be answerable and not already answered in literature. And it must be at least have some sort of improvement or showing that by doing this, I'll eventually be able to improve X, Y, and Z. It doesn't have to be, you don't do a project which is so bigger than your time frame and bigger than you, but something which is going to be this finer, which is going to be feasible, interesting, noble. It has to be ethical and relevant. Okay, so feasible. Feasible is the most main thing you need to address, especially in times where you have centers which don't have enough numbers and so forth. So you need to know whether you will get the population, the numbers needed, hence you need the sample size calculation. Whether the expertise to supervise you and whether to guide you, if it's something which is going to involve a radiology component, you have a radiologist guiding you, and time. Time is part of being feasible. If you're not going to have enough time to complete the study, don't embark on something which is not going to be finishing on time. Okay, and then you think about whether I can actually manage with this. Okay, interesting. It at least needs to be interesting to you, because if it's interesting to you, then it will be interesting to the panel who has listened to you, to the supervisor listen to you, because you will make sure that it is interesting for us at least. But if it's boring to you, please don't do it, because then you will come there presenting, not being very clear what you're trying to present. Next is, as we know, it has to have that so what effect. It cannot be something which has, it can be something which you've done before. Either you're trying to now disprove it, or you're trying to really confirm it, or you want to then extend that finding. So it's not that new means that never been done before, but something which is needed to be done, basically, and not really been done yet. People are doing and they're debating about it, and you want to say, no, no, go in this direction. Okay, next, ethical. So you cannot do something, whether it's animals or in humans. I'm sure you all have your GCP training, so you can't do anything which is not ethical, and that applies to research as well. Okay, not even just in your clinical practice. So don't go trying to do a study which is not ethical, where you remove an already practicing intervention without proper justification and safety. Yeah. Then relevance. So add to scientific knowledge, clinical health policies, and drives future research. Has to have some sort of long-term benefit and usefulness. So that was how you would come up with a good research question. How do you come up with a good method to answer the research question? That is the P-HOT, which is here. So you will have to define your patient, who your patients are, then decide what your intervention is, what are you going to compare it to, have the outcome of interest, and if it needs timing, sometimes if there's more than one time point, follow-up time points like at 3 and 6 months, then you decide on a time point. Otherwise, even until O, the outcome of interest has to be clear. Now, an example being your population is breast cancer, you're giving the drug with curcumin and without curcumin, so your intervention is adding curcumin, comparison is the standard practice, and the outcome of interest is probably in terms of looking at maybe very specifically, it may help improve fatigue or something like that. So, but something which is the best way of looking at its outcome, quality of life, and so forth. Okay, and then you decide whether your time frame is just immediately after, or you have a few time frames. So now, implementing it. So as I said, sample size, you have to calculate your sample size. Normally when you run retrospective studies and it's database base, you might not need to calculate because you're just going with universal numbers. But having said that, it's no harm justifying your numbers are sufficient to compare, to look at the main outcome of your study. You have to apply for your ethics, get funding if funding is needed, collect your data. Now, when I come to collect data, make sure you collect your data as wholesome as possible, because if you end up having too many missing data, when you get to the point where you want to analyze it, most of the analysis is not going to make, it's not going to be useful if there's so much of missing data, or you have to remove half of the patients out because you want a full set of data to analyze, which means you're not going to then fulfill your sample size. Yes, so when you set up your pro forma, so this is very important, when you set up your pro forma, make sure you fill in everything, whether it's retrospective, prospective, doesn't matter. Fill as much as possible. Of course, retrospective, sometimes when it is from the clinical records, it's missing. Try and fill in the gaps as much as possible. So the very important part of implementation is collecting data and collecting it correctly, wholesomely, and clearly not misplacing your collections, and making sure that you're able to trace back if you want to recheck the collected data information. Okay, and hopefully once you've done that, you analyze it, then decide your analysis plan. Now, analysis plan, when do you decide analysis plan? At the end? No, you should have the statistician already. If you go with your performance, say these are my variables, this is my research question, this is my objective. That's why we come to you must have a very clear and correct research question, because with that you'll be very clear how to analyze it and how to address all your objectives. And with that, you will come up with a very clear analysis plan with the statistician from the beginning So when you collect the variables, they can correct you, saying, okay, make sure when you collect this variable, say BMI, make sure you don't miss out the height, and make sure the height is recorded at least in cm. We can convert it to into meters later, but get it to this many decimal places. If you're collecting blood records, make sure you tell the group, if you want to group it, be very clear that you group it according to guidelines. What is the standard guidelines? So you're going to group it according to what is allowed. So all of that needs to be clear from the beginning, and you have your dummy tables ready by the statistician, so that at the end it's all about just analyzing and putting in the numbers in. So do the work ahead, do your work systematically from the beginning, so that it is less work towards the end. Because you're not only doing research is just one little thing, part of your training. You're being trained for a lot of things. Time is limited, and I'm sure you want time with family and so forth. So do these things ahead. It helps you. It reduces the unnecessary waste of time towards the end. And towards the end, you want to be starting to revise for exams as well. So do you really want to be keeping the thesis to the end? No. And then you will end up presenting this progressively, how you're going, and obviously defending your thesis at the end. And you might consider publishing it, but definitely you will write it up as a thesis for us to evaluate and your supervisors to look at. So this is no surprise, but this is the evaluation form. So why was I going about final criteria? If you see, part of the evaluation form, besides looking at whether your title is correct and so forth, we suggest that it should cover the purpose, the court duration, everything in the title. It should be feasible, important, novel, ethical, and clinically relevant. So we see that's the final criteria sitting right there. Okay, so if it's none of this, it's very hard for us to give you satisfactory. And more importantly, we will see whether the way you are proposing to study your research question is correct, which is the PCOT, and whether your sample size should be sufficient, because this will affect feasibility. Right? Because if your sample size is not going to be enough, and we know that you're not going to collect enough data, it's very hard to let you proceed, because we know that you're going to get stuck later on. And rather than letting you proceed in something which is not going to be feasible, we might as well ask you to correct it as early as possible. So start presenting your work to us, to the panel, and to your supervisors as soon as possible. And then if it's funding, you'll note down whether funding is needed or not needed, okay, and whether the way you're getting the funding is ethical and so forth. And obviously, your slide design and presentation is also looked at, overcrowded slides and so forth, okay. Now, some ideas. I'm not going to go into the breakdown of all of this. Obviously, I'm going to do the basic science aspect. But yeah, you can do sample-based studies, but more than sample-based, database studies. There are a lot of things which you can look at. Okay, you don't need to do phase 1, phase 2 trials and so forth. But there are studies where you can look at imaging, you can look at toxicity, you can look at education, giving handouts and so forth, looking at cost analysis. And so there are many things which, and looking at policy, improving policies or preventive measures and so forth. So as I said, you probably won't focus so much on phase 1. I mean, it is doable, but whether it's something which you want to take on, you should think about it. It is a bit more harder to run trials and RCTs, but having said that, it's definitely relevant when it's not been done before. But you can focus on studies which are observational, which are looking at cohort studies or retrospective studies. So these are some different kinds of study designs which are out there, okay? And just to expand a bit, so obviously if you look at just a single subject, it ends up being a case report. So your analysis can end up being quantitative, qualitative, descriptive, or even a mix of all of these things. So it really depends what you are dealing with. You can even run interviews and surveys where it ends up being more more qualitative, and so really there are a lot of things which you can consider as doing as a project. It is how well you design that study from the beginning, which matters. So this is just an example. I'm not going to go into each one of it. So they are given different objectives here, okay, and they're giving kind of what kind of study design which matches it best. So most of the you see they study say case control studies or cohort studies. Okay, they're not being very specific whether it needs to be done retrospectively or prospectively. So there are probably things which you can expand in terms of the design, but this is just telling how to pick between intervention, case control, and cohort studies. Cohort will be just disease only. Okay. So just as we get to the methods, other aspects, so I did cover a little bit, is the study design is what we kind of discussed. But what is very important is you must be very clear with your inclusion and exclusion criteria, and your measurements has to be according to the national guidelines. Okay, and your performer has to be tight, because if you don't come up with everything you want to collect and then you realize this extra variable which you need to then go back and collect, make sure you, when you create your performer, everything which will be collected is on the performer, so that once you go to records to actually document it secondarily, it is, you are not going to miss out anything for sure. Okay, now let's come back to the inclusion and exclusion criteria. So inclusion criteria is basically criteria which you will set so that you include them into your study. So you say breast cancer, and you want them maybe late, people who are presenting late. So what is your inclusion criteria from the beginning is breast cancer who are in stage 3 or 4, something like that. Okay, so you don't want everyone, but that's inclusion criteria. So from the beginning itself, you're very clear who you're including, and age and so forth, all the races, yes. Exclusion is when after you collect all this, you will end up by some sort of already preset things which you know you will exclude. So they're on this treatment, and whether they're on a treatment or say, so like, let's say stage 3 and 4, who end up saying at the end, maybe they will end up saying that they want to switch treatments, or they don't, so you can't document it, so you'll or the data is not in full, it's missing, a lot of the variables are missing, so you exclude. So those are your exclusion criteria. So say in an RCT inclusion criteria, so you set it that way, you're going to put them into a treatment laparoscopic arm and open, but so happen with the one which was supposed to be randomized into the laparoscopic arm, in between it was converted to an open, so you'll end up excluding it, and that's why you calculate also dropout rates when you do a RCT. Having said that, there are now ways of, even if you convert, you can factor that in, but I'm just giving an example. The exclusion happens after you have collected the data, not before. Okay, before is what are all the criteria, what you want to collect. So the screening in the beginning is what inclusion criteria, that's where inclusion criteria sits. Define your, they're already set, define your measurements clearly. Don't use different SI units at different sections. Seen this happen, hence I am highlighting it. And part, so most of these things will end up being part when you apply for athletes. So make sure your patient information sheet is in layman terms, easy for anyone to read and understand. So it shouldn't be in any fancy medical terms or terminology. And the patient consent form needs to be structured as well. And whether it's through next of kin, or whether it is the patient itself, or it needs a translator and so forth. Now, towards the end of this whole talk is, please avoid plagiarism. We've been repeating this for some time now among for the past year or so, because it is basically trying to present someone else's work as your own. It's dangerous, and so it's very important that you acknowledge it. Hence, there are softwares like Turnitin, which is compulsory towards the end when you're doing a thesis for you to run and show us the percentage of your report, because it is actually considered a crime because it is other people's work which we are saying. So it's a copyright issue basically. Now, I'm done with my talk. So there are many books out there you can consider reading to expand your research knowledge. uh, I believe our library do have some of these books, not all of it. But having said that, if you put in a request to the library, they can actually order some of these books for the library to have, which you then can borrow. But this is also not this is not just useful for you to run your projects, but it's also going to be useful for you to run your for practicing and studying towards the end for your exams. Thank you so much for listening. Yeah. Thank you for listening to me. I guess we'll now open up for questions. Thank you. Hi everyone. I hope the talk is clear. If anyone has any questions, you can ask me at this point before we move on with the next talk, which is by Jasmine. Any questions? You can put it in the chat box and I can answer in the chat box if you like. Okay, so then I think we can proceed with the next presentation. Jasmine, you there?
Yeah, I'm here. Just let me share my slides. Hi, everyone. Can you hear me? I didn't have any response from the floor.
Yes.
Yes, clear.
We can hear you. Thank
Great,
you.
excellent. So, so today I'm going to talk to you about literature review for research planning. I guess this is not the first time you heard about this word literature review. Is that correct?
Yeah.
Hello?
Yes.
Yes.
Yeah.
Good. So can someone tell me what literature review is? Anybody want to try? Quiet again. Hello. So I'll just take some. Okay, Brian Yo, would you like to try? What is literature review to you?
When we have a topic, then we want to go through what has other people done and what did the literature say regarding our topic that we have in mind, the research question. So we go through other people's literature, and that's what I understand so from literature review.
Okay, have a little bit here and there, the key points. What about other participants? Firdaus? Hi, are you there? Firdaus, Radwan?
Yes, basically,
You just switch on your camera, thank you, because it seems like I'm talking to myself. Yeah.
Hi. Basically, it's
Mm-hmm.
we are reviewing other similar design study, and we study their research question. We go through their limitation of their study, and we see the method design and whether it can be applied for our study. So if the limitations, maybe we can tweak the study design to address the limitation of the study,
Mm-hmm.
and learn as much as possible and how to reapply back or to improve the study design and for our study thesis.
Right. Okay. So I have I have an overview what are your understandings on literature reviews. Not too bad. Most of them match some of the essence of literature review. So literature review is basically a recap, a critical recap of what has already been researched on the topic. Okay, so the source of information can be from an important textbooks or research articles that I'm sure all of you are quite familiar with, or any other sources of information. Okay, so let's rewind slightly. So before we do a literature review, what should we have in mind first?
A research question.
Very well. That's good. Other than that? So we need to have at least a research questions, right, before we start our literature review. So for those who do not have a research questions yet, you at least have a research topic. Okay, so just bear this in mind, because with the research topic and the specific research questions, you can then start your literature's review. Okay, so so we go to the next thing. What is the importance of literature review? What is the purpose of you doing this? You know, reading like hundreds and thousands of papers. What is the purpose of you doing that?
I think it's Jasmine here. I think part of it is to see what is the void in research, and so that we do not, basically, I think research is so that we can expand the knowledge on a particular topic. So when we carry out literature review, we are able to see where is the void in that particular topic and probably address that as our research question, I think.
Okay, good try. Other people? Any other thoughts? Nigel Locke? Are you there? Hello? Putri Atika? Hello, are you guys there?
Hello.
Yep, Putri Atika. So what is your
I think
thought on the importance?
yeah.
Go ahead. Yeah.
So literature review, I think it's basically to have an idea on the research topics that you give, and to see what's other things that you can improve on, and also any additional information that you may add on or gain through your topics and with your research questions.
Yeah, I think everybody has some points on the importance of literature review. But to be more specific, literature review is basically to find out what is already known about the topic, okay, so that you can actually have critical overviews of what you have found to your readers, and more importantly is the unknown. What are the missing gaps that you are planning to, or you can address in your research proposals? All right, so literature review, the most important thing is you need to know what are the already known things and what are the missing gaps that you can address in your research proposal. Okay, so basically there are 4 important steps that I recommend for you when you are actually doing your literature review. Okay, so the first step is to search for relevant literatures on your topic. Second is evaluate and select the sources. Third is to identify the themes, the gaps, and the debates amongst your topic. The fourth is actually outline your literature reviews structures. Okay, I'm sure you have heard of this topic many times, but I hope I will be able to bring you some new insights with my sharing sessions today. Okay, so let's go to the first step. So when you want to search for relevance literature on your topic, one of the most important steps is to list out the keywords for your search, right? So let's say today, so I chose a very common topic so that it's less stressful for all of you, you know, and everyone can participate in this discussion in a more lively manner. All right, so I choose this topic is on social media's impact on the younger generation's body image. So what are the keywords that any of you can think of if we are doing this research topic? What are the keywords that we need to do the literature search for this topic? Anyone just want to try?
Social media, body image,
Other than that? This is what is stated in the topic, right? What other keywords that you can think of from here?
Body goals, fitness.
I saw someone saying like body dysmorphisms in the chat box. Other than that,
Body shaming.
body shaming. Okay. What other things? Some common terms, some more common terms. So you can use the word mental health. Okay. What other things? Okay, someone say you can use an example of social media like YouTube, TikTok. Yep, that's reasonable. So you can either use you can use the word mental health, or you can also have body image that one of you clearly identified that. You can also use the word teenagers, because teenagers is very similar to represents the younger generation as well. You can use the word social media, or you can use the word YouTube, TikTok, and or Facebook and Instagram. Okay, very well. You are following my talk clearly. Okay, next thing. So now we have listed some of the important keywords, and we have to know which databases that you are going to use. So any databases that you guys are familiar with? Anybody want to shout out the answer?
Netscape.
What else? What is the one that you guys most commonly use? Come on, it's not too difficult, this question.
Google Scholar.
Google Scholar, good. Someone say PubMed, yes. What else? Anybody else want to try? There's one more actually. JAMA, okay, JAMA is not a database, it's a journal. Medscape, okay, all right. So we have to, you can either use your library databases. Have anyone tried this before? Yes or no?
Oh, no, not yet.
Yeah, I think never. That will be a more appropriate answer. Okay, you can actually, in the library databases, there are a lot of different databases that you can use, okay? So because, so you can also use the one PubMed. Yep, this is my favorite. One of you told me the answer as well. Google Scholar, very commonly used by everyone. And this is called Web of Science. Has anyone heard of this before? No. Yes or no?
No.
No. Okay. So this Web of Science you can only access through your after you log into your library account. Okay. So you have to search it through library as a databases. All right. So now we know that in order to search for your literatures, relevant literatures, you need to have your keywords. You also need to know which databases that you can use. And I'm going to give you more quick tips. So in addition to keywords, you can also use synonyms. Like for example, we use the same research topic again. So like let's say we pick the word younger generation. So what are the synonyms of younger generation? Anybody want to try? Youth. Okay. What else? Teenager. Yeah. Can someone just shout the answer? Gen Z, very well. Okay, I think you guys are pretty good. Yeah, so you will have the Generation Z, teenagers, because these two groups of people represent the same age group, right? So you also can use the Boolean operators. Have anyone heard of this before? Yes or no?
Yes.
Yes. Okay, what is that?
If I'm not mistaken, is this the and or?
Yeah, very well. You done your homework, huh? Okay, very good. So basically Boolean operator, I think most of us have used it before. It's just that we didn't know that it's called Boolean operators, okay? So you can also use the keyword and, or not in your search. So for example, if you use a social media and body image, if you use a Google Scholar, so all the articles that actually appeared on the Google Scholar will consist of these two clauses at least. Okay. So if you use teenagers or younger generations, when you put into the Google Scholar or any search databases, they will either appear the word younger generations or teenagers, okay, as you can see from all these examples. All right, so if you use, like, for example, you want to use the minus, so you want to search for Apple instead of like the tag phone, Apple font. So you type the word Apple minus tag. So you will have the search showing you Apple as the content, you know, as an apple as a fruit itself instead of Apple iPhone. All right, so you use the minus tag to remove things that you didn't want to. You can also use the open exclamation mark to specifically telling the search engine, these are the 2 words that you want to be in there and nothing else. Okay, so for example, if you use this open marks and close marks for surgery and prognosis, so for all the articles that pop up in your Google Scholar articles, it will have the word surgery and prognosis only. Okay, it will not have like colorectal surgery. Okay, you realize that? But if you put like surgery and prognosis without the open and close remarks, you will have like maybe colorectal surgery and prognosis. Okay, so that is the difference. All right, very well. So you have gathered, you have searched so many articles using the tips that I shared with you just now. But how do you evaluate and know that this is the sources of information that you need, you know, for your literature review? So I'm sure that you have thousands of abstract that you identified, and it's impossible for you to go through the full articles for each of the papers unless it's a very niche area that you are looking into. So once you get this kind of papers or the link for the articles, what should you read in the first place to begin with? Anybody? Any answer? Can someone just shout the answer? No answer.
Sorry, not too clear about the question. Could you repeat it,
So
please?
the question is, you have done your search data, you use your search database, right? You put in the keywords that you would like to, you have the topic, and then you identify the keywords, okay? So you use a search engine, for example, Google Scholar, all right? And then there are so many articles that pop up. So how do you actually choose the one that, how do you select which one that is relevant to your case? What is the first sections that you will read, you know?
Citation, whether it's been cited before.
Okay, fair enough. Other options?
Or maybe
The title.
Sorry? Maybe the what?
Is it title?
Title, okay. Other answer? Siva, you want to say something?
Where was it published?
When was it published? Other than that?
The year of publication.
Okay. So actually, when I have the paper, when Google Scholar pop out a few like choices for me, right? You saw there are lots of links. So the first thing that I will do is actually click into the link. And then when you click into the link, what would you see first?
Or whether it's a full PDF or not. Is it?
Before you even go to the full PDF, what would appear in front of you?
I would like to read about the abstract of the article.
Yes, precisely. So you need to read the abstract first, right? Rather than reading the publisher or the publisher year of publish. I mean, that's crucial, but most importantly is you need to read the abstract first, okay? Because if you read the abstract and then you found that it's relevant to your case, to your research topic, only then you will find out the full articles, right? And then read into details. So with this method, by reading through the abstracts, you can actually select which are the articles that are relevant to your topic, and which are the articles you can actually just put it aside, you know, not too important at this stage for your research topic. Okay, so when you actually select the sources, you must first read the abstract first, okay, and assess whether it is relevant to your research topic. All right. So, and the second thing is basically your friend mentioned it. I think it's quite relevant as well, which is the citations and the references. Why is it matters?
With most references or citations, it shows is a good quality research.
Other than that, other than good quality?
Impact factor.
Yeah, that's right. So for example, like when I read the previous paper, I read through the references as well. And then I found that, let's say this second reference, okay, the developments of human benign prostatic hyperplasia with age. And then when I search further, I found out that actually this paper have 1,612 citations. Okay, so this indicates two things. This indicates this page, this is a key paper because it has a high citation count, and it also is an influential paper. Okay, so whoever wrote a paper on BPH, they will cite this paper for sure. Okay, and also another important thing is that, so when you know that this paper has this many citations, right? You can also click on these citations and have a look. What are the latest citations of this paper? Okay, because that with this method, you will then find out what are the latest paper that might be relevant to your research topic as well. All right, so because if I click on this, this is the key paper for BPH. So if I click on the citations, like the latest citations, I will be able to see, oh, okay, this is actually the, you know, the first 10 that pop out is actually the one of the few latest papers that cite this paper. And you also can know what are other people doing in the BPH field. Okay, any questions so far? Are you guys clear what I'm trying to say?
Yes, boss.
Yep, okay, excellent. Okay, so now we go to step number 3. Okay, we have search the resources, we have screen through it and select. So now it's important for us to identify the themes, debates, and what are the gaps in between. Okay, so why is this important? It is because you need to make connections of all the papers and the abstract that you have identified, which are relevant to your research topics. Okay, so these are the 5 key points that you can look into when you are actually identify the themes, gaps amongst the resources of your literature review. Okay, you can identify the trends and patterns, the themes, debates and conflicts, importance of publications, and what are the gaps. So it seems a bit abstract at this stage, right? So let me show you how could you do it, right? Okay, so for example, trends and patterns, you can look into the theories, the methods that have been used in the research topic, and also what are the results that presented. Okay, so let's say our research topic is still the same one, social media's impact on the younger generation's body image. All right, so when you look at the paper published in 2013, you can see that the methods that you use for social media is actually on Facebook. All right, so can someone tell me when is Facebook launch actually by the Facebook guy? Any idea? I know everyone uses Facebook. So do you guys know when was Facebook launch? Jason?
I actually have no idea. I think
you want to guess? Let's give some numbers.
30 years ago.
Sorry, 20 years ago is?
2004.
Good try. So it's around that area, not 2004, 2005, 2006. That is when Facebook was in the market, released into the market. Okay, so a few years down the line, you will see that all the papers, when they talk about social media, the one of the major social media that they use is actually Facebook. Okay, so when so after sometimes, you know that in 2018, the social medias that keep mentioning that being brought out in the paper is actually Instagrams and Snapchat. All right, so when was Instagram released? Anybody have any ideas? Hello? Mei Yi, do you know when was Instagram released into the market?
Not sure.
You want to try? Just throw an idea. Just throw a numbers. Just try.
Year 2000.
Sorry?
Year 2000.
Year 2000. Okay, it cannot be before Facebook, because
Yeah,
all
sure.
the so it has to be after Facebook being launched. Okay, Facebook is actually launched around like 2005, 2006. So basically, Instagram is launched much afterwards. All right. Anyone else wants to try?
2010.
Yeah, that's right. So around 2010, 11, 12, that's when the Instagram and Snapchat were released into the market. Okay, so you can see that that's what I meant by the trends and patterns in terms of the methods that we use. Okay, so hello. So like in 2013. Majority of the social media papers touching on social media will focus on Facebook, whereas in 2018, people start moving into Instagram and Snapchat as one of the key things for social medias. Okay. All right, so let's move on to the next one. So what about themes? Okay, just now we learned about trends and patterns. So themes are some ideas or some questions that keep repeating in your literature review, keep repeating in your resources. Okay, that's how when you found out that is an important themes in the papers that you are reading. Okay, ideas and research questions that keep repeating in those resources. So for example, the themes for like social media, in social media impacts on the younger generation's body image, the word like mental health actually is keep repeating in those resources, okay? As shown on this paper. You can see the word mental health here, mental health first, and mental health everywhere. All right, so that's what it meant by themes. Okay, so and the next thing is debates and conflicts. All right, so for the topic on social media's impact on the younger generation's body image, what is the common thoughts on this thing? What is the common findings that you expect to see in a paper? Anyone else try? Naveen? Naveen, are you there? Okay, you're not there. Anyone else want to try?
It is social media has negative impact over young generation's body image. I think that's the common perception.
Okay, that's correct. Yeah, there is the common thoughts, right? That people say, okay, social media actually influence negative impact on the younger generation's body image, but there will be some papers saying that, you see, as shown on this paper, okay, it says that the experimental study actually suggests that Facebook account does not negatively impact the young woman's appearance concepts. Okay, so this is what I meant by debates and conflicts. I mean, you will find this kind of results as well in your research topic. So the first thing that you need to look into is actually what are the methods they are using to study the questions. Okay, are they actually comparing apple to apples, or they actually comparing apple to orange or apple to durian? Okay, are they using the same methods, or do they actually have enough sample size and things like that? Okay, so you must be prepared that there will be some conflicts findings in your research topics. It can't be like everybody agreeing on the same thing 100%. All right, so you must remember that always. All right, I saw some answers from the chat as well, very well, saying that the negative impact. Okay, so the next one. So what are the for your literature review, you always have to include a very pivotal publication. So when an apple falls on the a young Isaac Newton, right? Isaac Newton's head, So what did he discover?
Gravity.
Yeah, precisely. So whenever you write a paper on gravity, you have to cite these important publications. Okay, so that what I meant by the key publications. Okay, you must always cite the key publications in your field. I'm sure will be familiar with that on the, like for example, a specific surgical procedures that you're performing that is involved in your studies. You must always cite the key papers on that. All right. And gaps, okay? So for example, the same topic again, and then we found that actually a lot of the studies are actually focusing on adolescents, girls, young women, and even for some study group, focus group studies, they actually have more girls than boys in the study. So this is the gap that you can address, like a lot of people actually look into the social media impact on ladies and girls' body image. What about the effects on guys' body image? Okay, so this is one of the gaps that you can identify and proceed and address in your research proposals. Okay, so step 4. So you already know how to search for your literatures. How do you actually evaluate it? And then how to identify themes, gaps, conflicts. And the step 4 is actually how do you actually outline your literature review structures? You have found out so many informations, right? But how do you actually arrange them accordingly? All right, so I can share with you some methods. So basically there are 4 approaches. You can either use chronological approach or you use thematic methods or theory. Okay, I'll go through with you one by one with very simple examples that you can understand it very easily. All right, so for example, chronological is you can actually describe the literature of your research topic from the older publications to the newer publications. Okay, so if you look at if your research topic is actually on mobile phone, so it's a very clear cut that the old phone was so much difference compared to the latest iPhone, right? So you can actually, for chronological approach writing, you can actually analyze the patterns of the phones. What are the turning points? I would say the iPhone is actually the turning points in mobile phone applications in our daily life, and what are the debates in between, because people are spending so much time on the iPhone, people are less able to, communicate with others in person, okay? So another thing is thematic. How do you write a literature review from the thematic approach? So for example, if your topic is the same topic again that I picked for you all, so you can pick the big theme first, okay? You talk about the negative effects of social media first, okay? And then you focus it slightly into the mental health issues among the Generation Z. And from there, you bring in the body image issues among Generation Z. Okay, you kind of get an idea how to do it. All right, so in terms of methods, you can actually describe the results from an observational study first, and you compare it with the experimental study. All right, finding out what are the similar results and what are the differences between an observational study and the experimental study findings for your research topic. All right, and theories. Okay, so in terms of theories, you can look into theories of your topic. What are the models and the definitions? Okay, so like let's say if we use the same research topic, I will pick body image. So I will look into it in terms of definitions. Okay, so there are so many definitions of body image. The first one is actually you must love the way, love yourself just the way you look, or actually body image is something like, oh, you must be someone's, you must have some perfect figures that actually suits someone's, measurements, right? So these are the way that you can describe your literature as well. So are you all ready to write? Yes or no?
Yes.
Yes, you sure? Are you sure? Have you started writing your literature review?
No.
Not
Sorry?
yet.
Okay. All right. So I'm just gonna give you a few more tips, to help you to kickstart your writing of your literature review. Okay. So I found this quite useful, so I like to share with you all. So you always begin with an introductions, right? And then you will have some body paragraphs and the conclusions. All right. So into introductions, what should be into the introductions?
About the topic, the definitions.
So you have to, actually, it's importantly, you need to restate what is your research questions, okay? And then you emphasize the timeliness of your topic, as what is shown in the example, and also you highlight the gap in your literatures. All right, just give an overview of the research topic. All right, so people have an overview on that, okay? Because the things that you brought out in your introductions, you might repeat again in the body paragraph and describe it and elaborate it in further details, all right? So for the main body, you will need to, which is the body paragraph that I show you in the pictures, the 3 body paragraph, you will have to summarize and synthesize the information that you have obtained. You need to analyze and interpret, critically evaluate, and structures paragraphs. So this seems very abstract as well. So let me give you some examples, okay? So what does summarize means? Quiet again. I'm gonna pick someone then. Atika. What does summarize means here? Hello, Atika, are you there? No. Okay. What about Chai? Chai Hun So? Hello?
Could I try?
Yeah, you have tried many times. It seems I only have 1-2 students in the class. Ask one, I'll get one more person. If not, I will let you try. This Hawkin, are you there? More like an overview of the topic. Okay, I have one more student that is a silent student, but at least he gives some response. Okay, it's Brian. Yeah, that is good. Summarize, it means summarize means you actually give an overview of the main topics. Okay, what does synthesize mean then? Munira, you want to try?
To put in simple words or
just simple words, yeah, so everybody can understand. Yeah. Synthesize means
to not to say conclude. How do I say it? To make it oh yeah. Okay.
So basically, accidentally pressed it. So basically, synthesize is so summarize is you give an overview of your main points, right? Synthesize is basically you make an overall point stating what are the similarity and differences in your resources. Okay. So from here I can show you an example. So for example, those in pink, the pink color one is, or is it purple? So you see, I give an overview, meaning I give an overview of body dissatisfactions by expressing the definitions. Okay, so I only call one paper. This is called summarize. Okay, so when you synthesize it, you will actually have a sentence with couple of references expressing the same volume, the same context. Okay, so this is how you combine all your references together for the same context. Okay, so for over here, like for example, leading cause of eating disorder, this and psychological well-being are actually mentioned in these 3 resources. Okay, that's why we group them together. So this is what we call summarize and synthesize. Okay, so next one, analyze and interpret. So so can you just read quickly on this paragraph? So which part of that shows that you have analyzed the data? Which words that shows? Anyone have any answer? Nurul Alis Ramli, are you there? Hello? Not there. Okay. Premanandan Nail.
Hi. So from this, I can what I can tell is basically we kind of figure out what is the literature say.
What are the words that shows that you have analyzed and interpreted?
That means the body issues, are taught by the research.
Sorry, yeah, I couldn't get you. Basically, my silent audience students have provided me a good answer as well. Brian, he said consistent evidence. Yeah, that is one of the keywords that it shows that I have analyzed and interpreted the data. Okay, so when I say consistent evidence that body image issues are influenced by engagement with the visuals and interactive aspects. So this shows that I have analyzed my data and I interpret it and I put it into words in my literature review. Okay, so I'm sure that when you read a lot of papers, these are the words that they use as well, you know, especially in their introductions. Okay, next one, critically evaluate. So let's have a quick read on this paragraph. So which are the words that shows you critically evaluate the papers? Oh, okay, sorry. I tekan, so you already got the answer. So it's like so I critically evaluate by saying there's no longer adequate for understanding it and may not be relevant. So these are the words that you can use. Okay. Next one, structured paragraph. Okay. So you have structured paragraph. You can see that over here you will have a topic sentence. You know, as example of this one, body image issues have been widely associated with social media usage, particularly in young women. Okay, women's. So the topic sentence is to this kind of like summarize the whole thing that you're going to say. So when once people read about this topic sentence, they know what you're going to say next. Okay, so and also in order to you know, connect from one paragraph to another paragraph, so you can use the words like however, in view of the current developments. Okay, so that people can see the flow of your stories of the literature review when you start writing. Okay, and especially in the conclusions. In the conclusion, you should once again show how your research addresses the gaps and also how your research is gonna contribute to new knowledge. Okay, so and it's very important before you actually submit your research proposals, you know, and especially your literature review, because you are writing a lot, and I know you will do a lot of copy and paste as well, but make sure you're not caught by, you know, the software. So you need to proofread it, you know, before you actually doing the submissions. So when you proofread it, you should look into the typos and check whether you are overusing the passive voice, whether they are repetitive phrasings or they are informal languages. What do I mean by informal languages? Can someone give an example?
Maybe like saying, you know, it's not.
Yeah. So in the literature review for like scientific writing, you don't do it like, do you know that you know, do you know that the prevalence of prostate cancer is very high amongst Asians? You don't write it that way. Okay, you will do a scientific writing saying that the prevalence of prostate cancer is this much a percentage worldwide, particularly in Asians with higher mortality rate. Okay, so these are the informal language, so you should avoid those in your scientific writing. Okay, so that's it from me today. Good luck to all of you. So any questions so far? No question? Or I'm going to ask you a question. So if you are writing a thesis, right? So how much literature review should you write in your thesis? What is the proportions? Yap Wen Chi. You have any idea?
Sorry, I'm not sure. Maybe 5, 10.
No, let's say your thesis is 100%. So you think 5 to 10% should be your literature review, yeah?
Yeah.
Okay, so either say at least 10 Ryan say, I think not more than 20. What about the rest? Any guess? Jasmine, what do you think?
I'm not too sure if there is a particular number, but
Okay.
I guess to see, I think my question also is how much you read and how far the circumference of how much you read. That's something I think I'm not too sure.
Yeah.
I don't think there's a number that we can put.
Mhm.
I'm not too sure.
There is an unwritten rules actually. So in a thesis, your literature review should be 1/3 of your whole thesis. Okay, so it's 33.3%. So there's a lot that you need to write. At least 10% or no more than 20% is too little. So literature review should consist at least 1/3 of your thesis. All right. So that's it from me today. If there's no questions. All right. Thank you.
Thank you for your talk,
Thank you.
Jasmine. Yeah. So there's no questions for Jasmine. We will proceed with the last talk for today, which is by Dr. Tanya, where she'll be covering on ethics and grants. Tanya?
Can you hear me?
Yes.
Ya, 30% tu daripada kita punya thesis. Maksudnya berapa thesis apa?
Still you have question? I can hear the background noise. Can you hear me?
Yeah, I can hear you. It's lagging a little bit.
Okay.
I can hear you. Yeah.
Okay. Good afternoon, everyone. So today I'm going to talk about the ethics and funding, two things. So before I start, I want to know how many of you actually start your ethics or proposal?
Not yet.
None of you. Do you have any proposal?
You can put the answers in the box if you don't want to unmute and speak.
Okay. So you haven't done anything yet. Okay. So maybe it's better to start my talk first. Actually, once you start your proposal, you decide what you are going to do. You just write down your protocol. Then we start the ethics, application of ethics, and then the ethics comes first thing that you start doing for your research, just after writing your proposal and other things. So first thing is the ethics. I think as a medical doctor, all of you has gone through the Hippocrates oath, and you know already the ethics very well in your profession. So ethics is actually the moral reasoning of an action, and for the medical purpose, actually you know all the rules and the. Can you please mute your mic? So for the medical profession, you already know what are the ethics for you as a doctor. But when you start your research.
Tanya, I think your slides are not moving. Or are you still on your title slide?
No.
Yeah, it's not moving. You have to, and share it not as a slideshow. It's not shared as a slideshow yet.
I already did.
Let's retry.
Is it okay now?
No, it's still, we can see your slide panel on the left. So which means it's not slideshow yet.
Sorry about. Is it okay now?
Yeah, yes.
Okay. So as I mentioned, when you start your ethics research project, you need to have your own ethics, right? And the ethics actually, the moral reasoning of an action, that what you are supposed to do, right and wrong. And for the research ethics, you need to know lots of things for your research project, what you are going to do or what you cannot do for your project, and what are the rules actually you need to follow. Actually, the medical ethics comes because there are lots of questions arise in the profession, medical profession, and mainly the Declaration of Helsinki. That one is the most famous rules and regulation done in medical, for the medical ethics, which is done in I think it was done in 1964, because all of you might know the thalidomide scandal, right? The drug that is used for the pregnant woman without any proper clinical trial. And that time, many children died and many children has disabilities, which arise the question that before any trial, before any drugs in the market, it need to be go through the regulatory bodies. And that's the reason actually the World Medical Association actually implement the Declaration of Helsinki. The Declaration of Helsinki actually is the recommendation guiding medical doctors in biomedical research that is related to human subject or identifiable human material or even data. Like, you are not dealing anything with the human body, but data is there. So you think that I'm not doing any harm to the human, but actually you're dealing the data. So you need to keep the privacy and you need to maintain the ethics as well. Okay. So the main concern of the Declaration of Helsinki was the concern for the interest of the subject must always prevail over the interest of science and society. That means, although you need for your own research, you want to identify anything, but you cannot break the rule. Like, you cannot do something harmful for the subject. Like when we do the clinical trial or anything, there is a control or placebo group and also the case group. So you normally, it's like you give the drugs to the one and the placebo or without drug or something we can give. But we need to measure the thing, like what you are actually giving or what harm you are doing, that the other part, like the placebo group, without giving them any drug. So that's how the research ethics comes, like what you are, how much extent you can go further or what you can actually give to the patient. So actually, in the Declaration of Helsinki, there are a set of ethical principles, and actually it was concerned more about human research ethics. The first thing it comes up, the well-being of the human subject should take precedence over the interest of science and society. And it also declared first time that the consent should be in the writing. Okay, it's not like verbal, because sometimes we do the verbal one, it comes like actually the consent for the research was not taken. Okay. And then another important thing about the Declaration of Helsinki is that use of caution if participant is in dependent relationship with the researcher. Like you cannot include your relatives or other people. Okay. And then the limit use of placebo, like how much you can actually use, or if it's the dangerous something, or if the disease is fatal, you cannot do the trial, right? And then the most important thing is the participant benefit from the research, like how much actually they will be get from the research. And that's why in the every ethics there will be a clause like what you are going to get and from the research, the outcome as a researcher, and what will be the benefit for the participant. Okay. So when you do ethics, you apply for your ethics, actually there are two part of the medical ethics, two bodies you can go for. One is IRB, that is Institutional Review Board. That is the review board in your institute. Like in UMMC, we have a UMMC Medical Ethics Committee. You can apply ethics there. And for the national one, like Ministry of Health under, you can apply for the National Medical Research Registry, the MNRR. These are the two website link. You can go through there, go into there, and then you can explore. Okay. The UMMC one actually does the subject involving with the human, or if you are involved with any biological sample, then you need to go through the UMMC Medical Ethics Committee. But sometimes we need to go through both UMMC, the Medical Ethics Committee, as well as National Medical Research Register, especially if you are doing something like clinical trial or big study, or maybe different hospital are involved. On that case, actually you need to be taken ethical approval from the UMMC as well as the NMRR. Okay. So how you are going to apply for UMMC ethics approval, all of you have the UMMC portal. So what you can do, you can go to your e-service. From the e-service, you will go to your iResearch, and then you can apply. Okay, application form new. There are the new one, and then again, once you need the amendment, there will be in your portal, it will be the amendment form. You can apply later, like amend later if necessary. This is how it looks like when you enter the portal, new application form. Like step 1, general information, you need to fill up the project title, protocol number, research type, clinical research subtype, then details is there, you need to tick. Okay, here. Then step 2, like research details. Step 3, project information you need to fill up. And step 4 is the methodology. And 5, ethical issues. And last step is review and submit. Okay. So once you go to instruction to apply, you will get the deadline and also the dates when you can apply. Like normally minimum 1 week before the ethical review board meeting, you need to submit your ethics, and then they will approve it. Or they sometimes will call you back and ask you for amendment. Okay. So normally every month there is a schedule one. It is done every month. So if you cannot make it this month, then you need to try next month. Okay. After the UMMC one, this is the portal you can go to apply for NMRR. First thing, you need to log in. You need to create your own account, and then you can go to the NMRR ethics approval portal. Okay, they are more strict, and you need to do more thing for the NMRR. Actually, need to fill up more things than the UMC one. Okay, because the UMC one is the local body. That's why these are the, like for this year, these are the timeline, and the cutoff day is the last day of submission to enter the meeting. So these are the cutoff day, and the meeting date is like for the NMRR one, actually need to submit minimum one month before. Okay, this is how it looks like when you enter the NMRR portal, and then you need to actually fill up all these things. Okay, like the before one. So these are the ethical things you need to do for the ethical, and also for other thing. Actually, we have in CIC clinical center actually does good clinical practice one, that is 3-day workshop. Normally they teach you what to do and what not to do, everything in details, like especially the ethics related everything you will get in good clinical practice course. Okay, and for all the student, actually you are supposed to go through the GCP course 3-day one. Okay, previously it was actually 4 years per cycle. Still now they make it 3 or 4 times. Like nowadays it's online one. In February there was one 3-day workshop, and in May actually there was 3-day workshop again. So as you are medical student, you must go through this one. Okay, GCP course. And actually one of our MLT will normally circulate this GCP course details, and you will get from the info. Okay, and here are some details about the GCP course you can get from here. GCP course is very important because it's actually talk about the ethics and IRB in details. Okay, then the informed consent process, because when you will do your ethics approval thing, then you need to submit the patient information sheet as well. And then how you are going to take consent, what is informed consent, the other details thing. Also, you will get to know the role of study coordinator or clinical trial and other things, working with the sponsor and invigilator responsibility. Maybe at this time you don't need to know that much about the clinical trial and other thing, but as a physician you might be part of later, might be clinical trial. Okay, then you need to know your responsibility. Okay, the next thing is after the ethical one, actually the ethical two from the NMRR and the UMC one, I will just show 2 sample later after the grant one. Okay, the grant one, to be honest, for the clinical master student, I couldn't find any suitable grant for you to apply. Okay, previously there was an internal grant for you, that was postgraduate research grant, which is no more available. Actually UMSI, they stopped it since 2017, but there are some other internal grant and external grant. Like internal grant, like the small one, research fund assistant BKP or UMRG or IRG or other thing. And so there are some national grant and international grant. What from your side you can do, your supervisor can do the grant, and you can be part of the grant, like helping with the write-up. Then you can be co-PI or co-investigator, and then you can actually get the grant money as well for your research project. Okay, this is the only way you can get some money for your research funding. For the grant, actually there are lots of things you need to know, but I just put here the summary of the grant. Normally, typically the grant has some, you need to write up the executive summary. Okay. So the executive summary should be consist of background of your research, objectives, and problem statement. And then the problem statement is the needs, approach, benefit, and competition, all those things. You are doing the summary, okay, not the abstracting. And then the brief methodology also need to put here, okay. And then after the executive summary in the research grant, when you write up, we normally do the abstract, okay. So the abstract is the gist of your research, what you are going to do. You need to explain there, okay. And then you need to write down the, after the abstract, normally they ask for the research background, which is introduction, and then hypothesis and research question and literature review, consist of these 4 main parts, okay. And then after the introduction, actually you need to write the objective. There are different ways you can write down your research objective, which is not only for grant, also for your research project as well, okay. So some says like, normally we do the general objective and specific objective. General objective is like you write the main thing you want to going to explore, okay, the objective of your research. And the specific one, then you break down it and then write down one by one what you are going to do. But for the grant purpose, sometimes they say the objective should be SMART, which stand for S for specific, significant, stretching, and M for measurable, meaningful, and motivational. And A for agreed upon, attainable, something like that. And R for realistic, relevant, like you can do it or not. And T for time-based or time-bound, because when we do for apply for grant, actually we are competing with other people. So it should be SMART and it should be lucrative, right? And after the objective, normally for the grant, we need to write down the methodology part and the references. Just now, I think you saw from the Jasmine presentation, like references and those things. And then the flowchart of a research program, which is mandatory. Actually, when you write down your research proposal, you have this, most of the things already there, like flowchart of a research program, the whole thing, how you are going to do your research project. And then Gantt chart. So we made the Gantt chart according to the grant timeline, and then the budget according to the money they are providing. But we always encourage student to preparation should be less, so you can do it, okay, because you are clinical master student, so you need more time for the clinical purpose, okay. So that's all from me, but I want to thank Jasmine and also Gauri for their some of their slides, okay. So I want to share with you the form for the NMRR. Can you see my?
Yes.
This is the UMC ethics approval portal, okay. One of the protocol. Once I show you, if you go to your UMC portal, you can go. You can enter your iResearch and you can go submit your ethics, right? So this is how it looks like. This is the submitted one. I'm showing you one of the example, like project title, then protocol number, this one, then category, then research type, clinical research subtype, general area. What are the things you need to write down, fill up, okay? This is the one. Like, other than this, has a similar application been previously approved by the Research Ethics Committee, or someone has done inside the Malaysia or another country? These are the common question in the research project. Then your investigator name, other things you need to fill in, and then you need to fill up the project summary like this. Just now I mentioned you the grant one. Actually, for the ethics also, you need to do the same thing. Okay. Like here, like the project summary, you need to summarize your project. And also, this is for the ethical purpose, right? Then you need to explain, have similar studies been done before or not? Okay. Then if not, then you need to explain a bit more. Then why it is important to conduct this study. As I mentioned before, like when you do ethics, you always need to remember why you are doing this and what will be the benefit for the participant as well. Okay. So why it is important to conduct the study, then the objective of your study, then timeline, then research funding, also the methodology part. Like the methodology part here is not written, you cannot see because in the protocol is actually attached. Okay, so this one, and then what exactly you need, all the information you need to put in the ethics. Okay, these are the details, and then who will be included in the study and other things. Okay, who will be recruiting the participant, you or research assistant, and who will perform the data collection. If you collect the sample like blood, anything, where you will gonna keep everything in details, you need to write down here. Okay. And the important things are the new drug procedure will be tested. I think for you, you are not going to do that type of study, so you don't need to know these things, but these things actually need to put in details. Okay. And then the details like research involve any clinical procedure, those things in details you need to write down. Okay. Then like ethical issues, this is the important thing. What are the benefit of the study to the research subject? What are the potential risk and burden to the research subject, and how will you minimize them? Okay. And then what are the potential risk and burden to the researcher and public? These are the ethical things you need to clear. Okay. And where you are going to keep the data, like confidentiality, other things you need to put in your ethical one. Okay, these are the details. I think this is for UMC site. Okay. Another example, I'm going to show you the NMRR one. This one, I just show you the protocol for the ethics we submitted. Protocol actually put in a way that you put everything like what we need to, we can copy paste from the protocol, the details to the ethical one. Okay. For the NMRR, as I mentioned, you need to put more details like research synopsis, which is the gist or summary. Okay. Summary of your research. They ask everything, study design, objective, study outcome, those things. Okay. And then background of your research. Then literature review. Then the research question or hypothesis, anything you can give, but for normally research question is preferred. And then the objective, general objective and specific objective, then the methodology in details. Okay. All these things. Okay. And then the study procedure, these are the part of the methodology, like sample size, withdrawal, the other things, and then the flow chart, how you are going to recruit and other things. Okay. And then the data analysis, other thing. This might be a bit extended because NMRR, they want many information from you. Okay. So the expected outcome, risk benefit assessment, those things you need to put for NMRR. Then privacy and confidentiality, conflict of interest, publication policy, everything you need to put in details in your protocol, also in the NMRR process. Okay, when you submit. Do you have any question?
Does anyone have questions for Tanya or questions for any of us today?
I have a question. So basically, for most of us, we're either half of our studies is in a MOH and then we'll return to PPUM for the third and fourth year. So safe to say is that once our proposal has been drafted up and it's been approved, we should just prophylactically sort of apply the NMR for the ethics part, PPUM, and also through NMRR. Is that right?
Yes.
Yes.
But if sometimes in MRR, if you applied and it approved, then you don't need to do PPUM unless you are doing something, you are collecting some information or data from the UMC side, then you need to do both.
Let's say for the patients, the subject of the research, right? So more likely than not, half is going to be from MOH, and the other half data collection will be done once we transfer to PPUM. So in that sense, might as well we just apply. Is that right?
Yeah, then
you
apply
need
for
to
both.
you need to do both, but one thing do first in MRR, and then in the UMC one we mentioned MMR already approved, so they already know actually it's ethically sound, so they don't make too much fuss.
Oh, I see.
it's
So we
easy.
just sort out the NMRR pathway first. Once it's all done and they allow us to do data collection, while I do data collection, actually simultaneously, I can also apply for the PPUM ethics approval.
Yes.
Because
do.
ethics approval must be, I must get ethics approval before I start data collection. That's right.
Yes.
Okay.
You must do it first before
Okay.
data collection.
So I must wait for PPUM approval as well if I already have NMRR approval?
If you have NMRR, you can do in MOH, but you cannot do in the PPUM.
Oh, okay, okay. Yeah, I understand. Okay.
Okay. Any other question?
So if there's no other questions, you can always email us with your questions if you're not able to think of any questions here. We can actually end the session. So again, I would like to thank the speakers, and also I'd like to thank you all for listening to us.
I
Yeah,
have
Tanya?
one thing.
Oh, yeah.
Sorry.
Go ahead.
I heard, I'm not sure it was in Malay, but for the literature review, they're confused about 33%, I think. I think this is because in your introduction, actually, you need literature review, first thing. In your literature review, you need literature review. And when you go to discussion, most of the part is literature review. You are comparing. That's how it comes almost 33%. Okay. Is it clear?
No, can I verify on that, Tanya?
No, I think it is specifically chapter 2, which is the review, is 33%, right? Anyway, Jasmine will be best to
Yeah, I
answer
think
this.
and okay, I mean it's a fair point that some of the your discussion will include some previous references, but it's important to remember that those things that you already mentioned in your literature review, you should not repeat in your discussion. Okay, so you cannot be discussing the same thing in literature review and discussions. So you must discuss with your supervisor which are the things that is less likely that you're going to put into the discussions, and thus you're going to do it in your literature review. Okay, so with the literature review sections is basically 1/3, thus excluding what is in the discussion. All right, discussion section is another section.
Okay, maybe I'm wrong, but that's what I know also.
Yeah, that's what I was taught as well. That's what I was taught too. Those things that in your literature review, those things that you have written in your literature review should not repeat in the discussion.
So this is actually towards the later part when you have your thesis. So you will have your sections as an introduction, obviously of abstract, then there's a section which later we have a series on dissertation. It's more focused for third years. But having said that, in that section, you'll have introduction, so abstract, then introduction, literature review. So that's the bit which Jasmine is saying is 1/3. Then you'll obviously then go into your methods on how you are going to conduct your study. That's another chapter. And then you'll have a chapter of your results, which is all your findings analyzed. And then you'll have a next chapter, which is your discussion, of which you'll conclude and give limitations, weakness, and strengths will be kind of, which is going to discuss your result finding and kind of justify what you're finding and give direction. So literature review is basically the background of everything. It can be background of the methods which you're going to be looking at and so forth. So that is 1/3. The other sections will basically make up the balance of the 2/3. Yeah. Okay. Is that clear?
Clear.
So basically, it is a big part. I think what we're trying to say here, since it's 1/3, literature review is a big part of your thesis. So it needs to, it's basically a little some summary guidebook or background to what your, for people to refer to so that they can understand more of what is already done previously. So that's why it's there in your thesis. Okay. Any other questions? Okay, so thank you for joining us for this talk series. We will have one next month. I think the next one is going to be on the 9th. And then there should be one about once a month, I believe. Yeah. Thank you.